our next presenter will be the Ontario Nurses Association. Welcome.
Thank you very much for having me. Good afternoon, everyone. My name is Angela Preocanin. I'm a registered nurse of 33 years and the first Vice President of the Ontario Nurses Association. ONA is Canada's largest nursing union, representing 68,000 registered nurses and healthcare professionals in Ontario, working in every sector of healthcare: hospitals, long-term care, the community, clinics, public health units, and industry. We also have 18,000 student affiliates. I'm here to deliver a very clear message. Without nurses, there is no healthcare. Our public healthcare system relies on nurses, and years of underinvestment having created a retention and recruitment issue, and this crisis must be addressed in this budget. We have a critical shortage of nurses and healthcare professionals in the province, and the situation is only becoming worse. Ontario has the worst registered nurse to population ratio in Canada. To simply reach the Canadian average for nurses to people, Ontario needs to hire at least 24,000 net new nurses. The real need is even higher as nurses leave the profession. Sadly, there is no viable plan from this government to build the care capacity we badly need. As a result, burnout is getting worse, nurses have been pushed beyond their limits, and the staffing crisis is becoming more dire. ONA has been offering to help, and our recommendations have fallen on deaf ears. We cannot afford to lose nurses to privately delivered for-profit health care. Allowing private corporations to deliver OHIP-covered surgeries will worsen the staffing crisis in public hospitals and degrade patient care as nurses are poached from hospitals where their care conditions have become unattainable. The 2023 budget must prioritize funding our public health care system with urgent measures to ensure retention of nurses and healthcare professionals and a sound plan to recruit tens of thousands more. Our members are telling us the same story across Ontario. They are overworked, burnt out, and suffering moral distress because we fear our patients, residents, and clients are not getting the care they need or deserve. The Ontario Nurses Association is proposing concrete actions the government can take to improve conditions of care for all Ontarians. First, we need to retain nurses and healthcare workers by improving their working conditions and showing them respect. This means dropping the appeal of the court decision that overturned Bill 124, the wage suppression legislation, and bargaining in good faith with our members. The government must also fund wage parity with hospitals across all sectors and to support retention in long-term care, home care, primary care, and all healthcare settings. Next, the government must bolster the workforce and plan for the future, starting with a recruitment strategy to bridge the RN care gap. This strategy should include increasing the number of RN seats in the colleges and universities by 10% annually and ramping up financial support, including OSAP grants. We want to see the Late Career Initiative brought back, which funds late career and recently retired nurses to mentor and support our new nurses. This initiative reduces attrition and helps ensure our new nurses stay in the profession beyond the first few years. We must also invest in dedicated funding for our sexual assault and domestic violence clinics to hire additional full-time sexual assault nurse examiners so that no survivor is turned away when they seek care. The third pillar for improving our public healthcare system is to ensure the safety of nurses and the healthcare professionals that work in the system. Violence has increased in recent years, and through the pandemic, significant gaps in infection prevention and control have been revealed. The government must fully implement the recommendations in the government's own Workplace Violence Prevention and Healthcare Progress Report. In addition, learnings from the pandemic must be applied, including guaranteed access to N95s or higher level of protection for all healthcare workers, and a plan to ensure sustainable care for people with long COVID. Finally, the government must stop privatization of our healthcare system. Healthcare is a service for the people, not a business to generate corporate profits. This means capping the use of private agency nursing and putting an end to price gouging for for-profit nursing agencies. We call on you to permanently raise the annual funding escalator for Ontario hospitals to a minimum of 7% and commit to increasing hospital funding by 15% this year's budget to address inflation and the staffing capacity crisis. We continue to call for the phase-out of for-profit long-term care homes and for the government to stop awarding new bed licenses for the profit homes. In home care, private companies should not be given contracts to manage care coordination for the services they themselves provide. This conflict of interest does not serve patients. Today, I'm asking you to listen carefully to nurses. By working with nurses, by having the courage to invest in what is needed, we can find the solutions to the challenges in our healthcare system. for our patients, for our communities, and for safe staffing. In our pre-budget submission, we go in depth covering the RN shortage, restructuring and issues in all sectors, from public health to long-term care homes, home care, and hospitals. We cover violence in healthcare and the creeping profit-making and greed in healthcare delivery. These issues underpin the challenges that face our healthcare system, and we outline the solutions in a path forward. So let's work together. The government cannot continue to expect that our nurses do more with less. We need a government that will be there for us too. As nurses, we cannot do our job without safe levels of staffing, and without urgent action to fix the shortage, things will only get worse. Replacing regulated nurses with unregulated workers is not a solution for safe patient care. There's no time to waste. Investing in the resources that Ontarians desperately need and deserve in the publicly funded, publicly delivered, and fully staffed healthcare system. Thank you.
Thank you very much for your presentation. That concludes the presentations for this panel.